Welcome to Medical Licentiate Emerson channel. Today's topic is Spina bifida, which is a birth defect that affects the spine. It arises during early pregnancy when the neural tube, which forms the brain and spinal cord, doesn't close completely. This opening can cause a range of disabilities, from mild to severe. Spina bifida is more common than many people realize, affecting approximately 1 in 2,500 newborns globally. While the exact causes are not fully understood, both genetic and environmental factors are thought to play a role. For instance, folic acid deficiency during pregnancy is a well-established risk factor. The impact of spina bifida extends beyond the individual to their families and communities. The emotional, financial, and social implications can be significant. Early intervention, comprehensive management, and ongoing support can significantly improve outcomes and empower individuals with spina bifida to live full and meaningful lives. The journey from a single fertilized egg to a fully developed baby is a remarkable orchestration of biological events. One of the earliest and most critical stages of this development is the formation of the neural tube. This structure, which emerges during the first few weeks of pregnancy, is the precursor to the brain and spinal cord. The process begins with a flat sheet of cells called the neural plate. Through a complex interplay of molecular signals, this plate folds inward, creating a groove that deepens over time. The edges of this groove, known as the neural folds, gradually move towards each other and eventually fuse, forming the neural tube. Spina bifida occurs when this intricate process is disrupted, and the neural tube fails to close completely. Understanding the embryological basis of spina bifida is crucial for medical professionals. Spina bifida presents in a spectrum of severity, ranging from mild forms that may go unnoticed to more severe types that cause significant physical disabilities. Spina bifida occulta is the mildest and most common form. It often goes undiagnosed as it typically causes no symptoms. In this type, there is a small gap in the vertebrae, but the spinal cord itself remains intact. Meningocele is a more serious form, where the protective membranes surrounding the spinal cord, called the meninges, protrude through the opening in the vertebrae, forming a sac filled with cerebrospinal fluid. Myelomeningocele, the most severe form, occurs when both the meninges and a portion of the spinal cord protrude through the opening in the vertebrae. This can lead to significant neurological impairments, including paralysis, bowel and bladder dysfunction, and hydrocephalus, a buildup of fluid in the brain. Understanding the different types of spina bifida is essential for medical professionals to accurately diagnose and develop an appropriate management plan. The clinical features of spina bifida vary widely depending on the type and severity of the spinal defect. Individuals with the mildest form, spina bifida occulta, typically have no symptoms. They may have a dimple, a tuft of hair, or a birthmark on the skin over the affected area. However, some individuals with spina bifida occulta may develop tethered cord syndrome later in life, which can cause pain, weakness, or bowel and bladder problems. Meningocele, while more severe than spina bifida occulta, often presents with fewer complications. The sac-like protrusion may be the only visible symptom. Myelomeningocele, the most severe form, presents with the most significant challenges. The exposed spinal cord can lead to paralysis or weakness in the legs, bowel and bladder dysfunction, and difficulty walking. Many individuals with myelomeningocele also experience hydrocephalus, requiring a shunt to drain excess fluid from the brain. Understanding the range of clinical features associated with spina bifida is crucial for medical professionals to provide comprehensive care. Diagnosing spina bifida is crucial for ensuring prompt treatment and minimizing potential complications. Early detection allows for timely interventions, improving outcomes and enhancing the quality of life for affected individuals. Prenatal screening plays a vital role in identifying spina bifida early in pregnancy. Blood tests, such as the alpha-fetoprotein test, can detect elevated levels of a protein that may indicate a neural tube defect. Ultrasounds, which use sound waves to create images of the developing fetus, can visualize the spine and detect any abnormalities. If prenatal screening suggests spina bifida, further diagnostic tests may be recommended. Amniocentesis, a procedure that involves extracting and analyzing a sample of amniotic fluid, can confirm the diagnosis and determine the severity. After birth, spina bifida is usually diagnosed through a physical examination. A visible sac-like protrusion on the back is a clear indication of meningocele or myelomeningocele. Early diagnosis of spina bifida is essential for providing timely interventions and minimizing complications. Managing spina bifida requires a multidisciplinary approach, involving a team of healthcare professionals working together to address the complex needs of the individual. This collaborative effort aims to maximize the individual's potential and improve their quality of life. Surgery is often the first line of treatment for spina bifida, particularly for meningocele and myelomeningocele. In these cases, surgeons close the opening in the spine, protecting the exposed spinal cord and preventing further damage. The timing of surgery depends on the severity of the defect and the overall health of the infant. Following surgery, ongoing care focuses on managing the individual's specific needs, which may include physical therapy, occupational therapy, and medication. Physical therapy helps improve muscle strength, coordination, and mobility, while occupational therapy focuses on developing fine motor skills and adaptive strategies for daily activities. Individuals with spina bifida may also require assistive devices such as braces, crutches, or wheelchairs to improve mobility and independence. Managing spina bifida is a lifelong journey that requires ongoing monitoring and adjustments to the care plan as the individual grows. While advancements in medical care have significantly improved outcomes for individuals with spina bifida, potential complications can arise throughout their lives. Hydrocephalus, a buildup of fluid in the brain, is a common complication of spina bifida, particularly in cases of myelomeningocele. This condition can cause increased pressure on the brain, leading to headaches, vomiting, and developmental delays. Treatment typically involves surgically implanting a shunt to drain excess fluid from the brain to the abdomen. Chiari malformation, another potential complication, occurs when part of the cerebellum, the lower part of the brain, protrudes into the spinal canal. This can obstruct the flow of cerebrospinal fluid, leading to headaches, neck pain, and difficulty swallowing. Tethered cord syndrome can occur when the spinal cord becomes attached to the surrounding tissues, restricting its movement within the spinal canal. This can cause pain, weakness, and bowel and bladder problems. Despite these potential complications, individuals with spina bifida can lead fulfilling lives with proper care and support. Early intervention, comprehensive management, and ongoing monitoring can minimize complications and improve outcomes. Spina bifida is a complex birth defect that presents significant medical and social challenges. However, with a comprehensive understanding of its embryological basis, clinical features, diagnosis, management, and potential complications, medical professionals can play a vital role in empowering individuals with spina bifida to live full and meaningful lives. By promoting awareness, advocating for early intervention, and providing compassionate care, healthcare providers can make a profound difference in the lives of individuals and families affected by this condition. Through collaboration, innovation, and a commitment to improving outcomes, we can continue to advance the care of spina bifida. Together, we can create a brighter future for all those touched by this challenging condition. Thank you for watching Medical Licentiate Emerson channel. Please subscribe and like this video.